Mics are coming on, and we're live.
All right. Hello, everybody. Thank you for joining us today. I'm Abbey Senczyszyn.
And I'm Cassi DePaulis.
And so we wanted to start with just a couple quick introductions today, and then also talk about kind of some goals, why we're here, and then open the floor up to some questions. So I'm Abbey. I work at Prosthetics in Flint, Michigan. I am a certified prosthetist orthotist. I went to school at Northwestern, and then I did my orthotics residency at UW-Madison. And I completed my prosthetics residency right here at Prosthetics. And I have been a certified prosthetist since earlier this year in February.
And my name's Cassi DePaulis, and I'm a certified prosthetist orthotist as well. I work in our Brighton location, and I went to school at Eastern Michigan University for orthotics and prosthetics. So I've been doing this for about 9 years. So I'm excited to meet with y'all and have a nice conversation and questions.
So why are we here today?
Well, we're here and we just want to make a safe space for us all to increase our education and ask questions that might be concerning to any amputee. And you don't often get the chance to meet with other amputees and ask the questions that are that come to mind, and probably a daily thing that you deal with that someone else might be dealing with as well.
So we want to kind of help facilitate a conversation here. And so feel free to join in, offer advice to everybody else that's here. Ask questions, join in the conversation. That this is also for amputees to help other amputees and ultimately help provide tools for everybody to advocate for themselves and just provide information and help with education also. So before we get started, one of the topics we do want to address today is talking about goals. So that's a big thing that I think a lot of people come in with. We see a lot of people come into the office and maybe aren't sure if they're making a lot of progress, or they don't see the progress in the way that we see them, because you see it day to day. And so you're dealing with the day to day, and things can look very linear. And you're like, wow, like I feel like I'm at the same place that I was a week ago, a month ago. But sometimes when people come into the office, even 2 weeks to a month later, we see a lot of progress, and helping set some goals so that we can help you see the progress that you're making also. So we want to dive into that conversation today. But before we get there, I'd like everybody to go around and maybe do some brief introductions of who you are, how long you've been an amputee, and why you're joining us here today. So I saw Alexis, you were the first to join here, if you don't mind.
Sure. So I'm Alexis. I am a pretty new amputee. I had this done 3 months ago. I just finished meeting with my prostheticist about 2 hours ago. I had to drop off a letter to my orthopedic surgeon, get something signed, and bring it back to my back-to-hanger clinic. And I have this free hour, so I was like, oh goodness, I get to talk with people.
Good.
So it's nice getting to share my activity level. I am my activity level is very high. I bounce up the walls consistently and like to play with my animals, and so I'm a relatively happy person, I think.
And you're just starting this journey. Have you?
Yes.
You haven't been fit with a prosthesis yet, correct?
No, no.
You're just kind of getting the ball rolling.
Yep.
Good. Well, exciting. I know after the amputation, that's one of the big things we usually hear is that it's a waiting game of, okay, kind of waiting for things to heal, waiting for everything to be in a good place to start that process to get back up and moving and start working on your mobility again. And so it's always exciting when that time comes, you can keep moving forward.
Yeah.
So thanks for joining us today.
Awesome. Thanks for having me.
Lynn, do you want to introduce yourself?
Hello, everybody. I'm Lynn. I'm an amputee, 29 years. This month was my 29th ampiversary. So I'm
Wow.
celebrating that nicely. I'm a prosthetist and orthotist. And I enjoyed the meeting so much the last time. I was looking forward to joining again today. So I just enjoy people who are educating amputees, you know, and helping improve quality of life after amputation. So I definitely appreciate this and thank you.
We're very happy to have you back joining us again. And then Patricia, if you want to unmute yourself, if you don't want to introduce yourself, that's okay. But if you'd like to do a brief introduction.
Sure. Hi, I'm Patty. I've been an amputee for about 1.5 years. I had a complication after a hysterectomy and ended up with a left above the knee amputation. I've been doing pretty good. I've been struggling to get off forearm crutches. I use 2 forearm crutches, and my struggle now is to try and get to either 1 crutch. Obviously, I'd love to get to none, but I'm having a lot of trouble doing that right now. But other than that, I seem to be doing okay.
Good. And Patty, what's your experience been with physical therapy?
Honestly, after my amputation, I went to therapy I went to a rehab, which was great. Then I had therapy in my town, which is in Naples. My therapist was very good. She had never worked with amputee before. So I did a lot of walking with the forearm crutches and got to a point where she said, "You're doing great with the forearm crutches now. You know, we'll stop therapy, go home and see if you can progress." And I really don't feel like I've progressed since then.
And I guess what kind of level of activity have you been at home, like walking daily, and you feel like you've just been kind of stagnated at where you're currently at?
Exactly. Yes. Walking daily. I haven't been walking outside as much previously because it's been so hot down here, but now that it started to cool off a little bit, I'll go to the park and walk. And like I said, I can walk with the 2 crutches, and I honestly, I can walk with 1 crutch, probably maybe 20 steps. And then I almost get into a little bit of a panic attack and feel like I have to grab for anything that's around, whether it's a wall or a crutch or something.
Mm-hmm.
And that's about as far as I can do with the 1 crutch.
And so in the house, are you still using
Yes.
both the crutches in the house most of the time?
Yes. Other than, to be honest with you, I use one. I have a narrow hallway. When I go down that hallway, I'll use the 1 crutch because I feel like I have the walls on both sides if I need them. Once I get into like the open living room, dining room, kitchen area, I go back to the 2 crutches.
Mm-hmm.
Do any of the other amputees on here feel that anxiety sometimes when you're walking out and about? I mean, I know, I guess I'm just asking Lynn that, have you ever experienced that with your patients? Because I've heard that a lot, actually, like having that anxiety when you're walking out in the open or out in public around people.
Well, for me, I mean, yes, of course, with my patients, but it's like even myself, you know, depending on where I'm walking, I'm always looking way ahead of where my steps will be. So even for myself for 29 years, you know, getting different prosthetics at different times, you know, always try to refer back to physical therapy. So, you know, but yeah, for 29 years, it's still the same, you know.
Yeah. And I think it's important for patients, even especially new amputees, but even in the process, if you ever lose that confidence, you should always go back to physical therapy. And I think it just helps improve your confidence and obviously your strength and balance and all that. So yeah.
And balance is a big one of being able to put your weight through your prosthesis and feel confident that you know it's going to support you and that you can kind of stay and keep your weight on your prosthesis. So absolutely go back, talk to your doctor about physical therapy. because working on some of those, of breaking this down to kind of balance and coordination before we necessarily get into gait, of focusing kind of on some of those fundamentals, is so beneficial for building good habits and building that stability to feel like you have the confidence. And then starting small. So starting in the home, and it takes time and a lot of persistence in order to continue to make progress. So I think that actually segues pretty nicely, because that's clearly a very good goal that you have set, Patty, right? Of, okay, we're using bilateral forearm crutches and trying to get away from that. And I think level of assistive device is one that comes up so frequently. But I always encourage patients to not always look at that as a hindrance. So if you're using the forearm crutches and that's helping you do what you want to do and help you do it confidently and safely, great. And then having the goal to go from that to a lower level of assistive device of, okay, how do I do this but maintain that same level of activity? And so if you're using a walker, if you're using the forearm crutches and you want to go to a cane, of how do you progress in a way that you can do so confidently in order to maintain that stability of not necessarily, okay, I'm not going to use an assistive device, but it's going to change and reduce my mobility. Of how do we build up to that? How do we build good fundamentals and good balance and coordination to get to that level?
Yep. Alexis, what's a goal that you have for when you get your first prosthesis? You're muted, sorry.
I'll get back on my bike. I don't anticipate I'll need a cane. I'm a unique patient. Mine was caused by a tumor that progressed. Before that, on the same leg, I've had the leg reattached when I was run over by a drunk driver in a crosswalk when I was 15.
Oh, wow.
And I didn't have physical therapy for that. So I just was turned loose in my backyard and went running about and learned how to do it all on my own again. So I don't anticipate I'll need really any assistance.
Yeah, good.
I'm in really good shape, so.
Welcome, Kara. Would you like to share a little bit about yourself?
Kara, what? I think that might be Kara here.
Oh, I didn't know. Sorry, maybe. Never mind.
But Alexis, I also want to ask, just since we have kind of a group here and you are kind of starting this journey, what questions do you have? Do you feel like you've kind of, you know what process is coming, or what questions do you have that have been unanswered so far?
Does anybody have a moisturizer that they recommend? Like I use Lubriderm skin lotion for dry spots. Does anybody have another one they might like better?
I actually use Aqua 4.
Okay.
And that seems to, so it's kind of like a Vaseline, but if you just use a very thin layer, and that works perfectly for me.
Okay.
Does anyone have any other questions they'd like to ask?
I have a question.
Does anybody have, because I don't think I'll have a problem, but does anybody have like an antiperspirant that they prefer?
So one of the ones that I have a few patients use is called Certain Dry. So it's an over-the-counter antiperspirant, and you roll it on, but you would put it on at the end of the day. And it's something that you apply daily. And it works really well just to help, because perspiration management can be a big issue, especially within the liner. So there's a lot of sweating that when you first start wearing the liner, your limb's now acclimating to a different environment. And so giving your body some time that there might be a little bit more perspiration initially, but it's kind of like if you went without wearing shoes for years and years and years, and then all of a sudden you start wearing shoes, right? Your feet are going to be hot, they're going to be sweaty, that they're kind of in this enclosed environment that it's not used to being in. So that's definitely one to continue to talk to your prosthetist about also. There's lots of options there for managing managing perspiration. Hygiene is huge. So making sure that the liners stay clean, that your skin stays clean, and that we're managing the perspiration and kind of all of the bacteria that can come with that.
All right.
I've used Vital Fit is what I use now. They have a cleaner for your liner and for your residual limb, and they also have a moisturizer that works really well.
And you said it's called Vital Fit?
It's called Vital Fit, yes.
Okay.
And when I first started wearing my liner and my prosthetic, because I live in Florida, I had a lot of trouble with the heat. So I did use the antiperspirant that they just recommended. And that works very well too. And like they said, put it on either the night before or earlier in the morning before you're going to put your liner on. And I also had some issues with like a heat rash. And the Vital Fit, I think, is what has helped that. And they have the same thing. They have a day moisturizer and they have a night moisturizer. And since I've been using that, I haven't had any trouble with the heat rash at all.
Oh, awesome.
Nice. Thanks for the recommendation, Patty.
Yeah, thank you.
Sure.
That's one that I haven't had.
Yeah, I've never heard of it.
I will say there's also other things to help out with perspiration, and it's figuring out what works for you. And so some people have great success with a certain dry or some sort of other like topical antiperspirant. There's also an option called a sheath, which goes like under your liner, and it helps with moisture wicking. They're antimicrobial. They have silver kind of integrated into them, so that it helps manage some of that. And there's other options out there. So it's continuing to work with your prosthetist, talk to them. Hey, this worked, this didn't. I tried this, it helped for a little bit, but then I got a heat rash, and just continuing to figure out what solution works best for you. I will say that a lot of the perspiration management can come down to sometimes you have to take the liner off, dry everything off, and then reapply the liner. That on those really hot, humid days, that's really the best way to get around it. That there's only so much that can be done within the liner. And then sometimes it's okay, we got to take this off and clean it. And especially with high activity levels, that I know we have a couple of patients that do triathlons and go biking, and even Scott here, that he's like, yeah, sometimes it's you take the liner off and you're dumping out a little bit of sweat just because it builds up. So when that happens, especially, I know you mentioned that you're very active. So that water, when you get that perspiration in the liner, of making sure that that's controlled, because the more you have that, that's going to create a lot of friction and a lot of rubbing and can really irritate the skin. So making sure that that is managed well will help you kind of stay up and moving.
Oh, perfect.
Hi, Dave. Thanks for joining us. We did some quick introductions. If you don't mind introducing yourself quickly, how long you've been an amputee, where you're from, and what you're looking to maybe get out of this today.
Don't know if Dave's connected with audio.
Oh.
This has the video icon.
Oh, okay.
So if you tell Dave to connect with audio, then.
And Dave, it's looking like your audio might not be connected. So I want to make sure we get your audio pulled up here too.
I think it's Dave Laddie. Goes to stop it.
You might have to leave and rejoin and enable his audio when he joins.
Oh, okay.
Dave, I want you to go ahead and disconnect for me and rejoin. And then it might have a little pop-up when you rejoin that says connect to audio or allow it to access your audio. Sorry, guys, for the technical difficulties here. And then while we're waiting on that, I do want to say, so for any other questions too coming in, for those of us that are watching live, feel free to DM us or add a message in the comments. We are reviewing those also kind of as we're going through this. I know we have people joining from a few different locations here, that we are kind of screening all of those questions too as they come in.
Bill, did you say you had a question?
I do have a question. So it's getting to be cold and rainy and slippery, and then soon it's going to be icy outside. What kind of tips or what would you recommend for somebody who maybe this is their first winter with their prosthesis?
Did they hear the question?
I would repeat it.
Okay.
Yeah.
So he asked the question, what is some advice or some discussion of like what would you give advice for an amputee going through their first winter with their prosthesis? Like I actually had a patient come in that used a walking stick in the winter, because when you walk on the ice, obviously with your prosthesis, you can't really tell if the ground's slippery or not. And he found these little add-ons that you can put on the end of a walking stick or a cane, and it's got a little like stud that sticks out, so it helped like him walk through like snow or ice or whatever, and that was like his way of knowing that he had a grip on the ground, and that was pretty cool. Does anyone else have any advice or tricks that they do in the winter?
I will say shoe wear too can make a big difference. Of something that has kind of a nice grippy bottom. The one thing, if you're changing, that we have patients that come in, they wear tennis shoes or maybe some different shoes during the summer months and something different in the winter month. If you're adding a boot or something that's a little bit grippier and changing shoes in the winter, your shoe can change the heel height, which is going to change the alignment of your prosthesis. That just means that you need to have an adjustment done to make sure to accommodate the different shoe wear, to make sure that your gait stays consistent and the alignment of the prosthesis is still optimized to where it needs to be. So if you put on a pair of boots, especially if it's your first winter and you haven't done that yet, and you've been wearing the same pair of shoes for a while, and you put on boots and all of a sudden you're like, gosh, like I feel like I'm not walking the same that I used to, or something feels kind of just different or maybe a little bit wonky. That the heel height of the shoe makes a big, big difference. And I know I have people come in all the time that's the one thing that changed. And usually, as you do get used to people coming in and wearing the same pair of shoes, I'm like, hey, did you get a new pair of shoes recently? And they're like, yeah, I did actually. I'm like, oh, okay, well, I think I know what's going on here. So even just changing shoes, that there's a lot that we can do to make sure that you can comfortably switch between shoes, of just making sure that maybe it's putting a little lift in the heel so that the alignment is the same throughout all of the shoes. So what about anybody else? That I know some of you are from Florida and warmer climates and don't have to deal with the ice and snow, but sometimes it gets slick with the rain. So any slippery surfaces, anything else that anybody has tips for?
I just have a recommendation. I just this year I started buying Billy's footwear, and they zip all the way around, and they have boots that have a good sole on them. So
okay,
and it's I call it a faux sole, because it's probably 3/8 and accommodates for a prosthetic foot. So, but you have to get the ones that actually have, it looks like a boot with a heel on it. They're boots that are flat. It's almost like a negative heel. But
okay.
they're very cool. Because they zip all the way open, so you can just put your prosthetic foot right in. But also, if you have any mobility issues at your ankle, that helps also. So.
Yeah, those are cool.
I say I do love Billy's shoes. I've used those for a lot of different reasons. And I love the styles of them too. They're still stylish shoes that sometimes when you get into the accessible footwear, your options become limited. And that's the one thing that I love with Billy's, especially working with kiddos, where you want to have shoes that look cool like your friends. And I always love the options that they have. And the zippers, they work well, they hold up, they're super durable. That I always worried about that with the kids, of are they going to get ripped and pulled and tugged, but they are a well-made shoe.
Right. And they're cheaper too, because I wear a size 8 women's, but I can get the big kids size 6, and they're $50 versus $100. So
Oh, nice.
that's another advantage.
Yeah.
Yep.
All right. And Dave, I see that you joined us here and you have a microphone now. So I'll have you go ahead and introduce yourself to the group, please. Oh, we're going to unmute yourself, though.
Uh,
There we go.
okay. Something kept flashing up. So, yeah, I'm Dave. I actually, I'm a Bremer. I go to Bremer in Saginaw, Michigan. So they take care of me there. And I just got on it, not quite sure how to use this thing. So
You're doing great.
Yeah.
plus I noticed it's quite a few women on here, and you're talking shoes, and that's, but the issue with the shoes that I have, I just come in, so I don't know where you guys are in the conversation here, but I have wide feet. So the tough thing I have with shoes is I can get one to fit my good foot, but the shoe's always a little bit big for my prosthesis foot. So, and I caught something about winter there, and I don't know if you were talking about what kind of shoes are good to wear on the ice or not. Is that what the conversation was?
So we started talking about how to manage. We had a question come in for somebody that's going through their first winter as an amputee and dealing with kind of the ice, the snow, the slipperiness. And we talked about using like a walking stick, something to help with maybe another level of assistive device to have you have that extra point of contact to increase stability, and then shoe wear, like things that are grippy. But I know you've been through a few winters here.
Oh yeah.
If you have some other tips too to add on to that.
Yeah, learn how to slide. No, I would guess if you're really concerned about it, I noticed that the male people that walk around on the sidewalks, they have a slip-on, goes over top of your shoe, boot, whatever, and they're like little tiny points on the bottom.
Yeah.
So if you know you're gonna be on ice, I guess that's something you might want to use. Other than that, it's just what I do is I walk like it's my first steps again when I'm on the ice. I just be real careful because when your prosthesis leg starts sliding, you don't realize it till you say, "Well, I guess it's too late," and then you end up falling. But you just got to be really, really careful.
I know I went to school for my undergrad. I was up in the UP, so the Upper Peninsula of Michigan, and we got all sorts of snow up there. And what would happen is that it would be this really wet, heavy snow. And when they would come to plow, they would plow the snow and make like this really thin sheet of ice. So it was horrible to walk on. You would always lose your balance. Everything there had like just enough of an incline to really make it difficult for people. And you would fall almost every day on your way into campus. And just slip and slide, and it was difficult. And one of my friends told me, he's like, you just have to kind of walk like a penguin and waddle. And what happens is that when you do that, your weight shift, you're not transferring as much weight, and you have a wider base of support to kind of support. And like you said, with kind of going back to taking that extra bit of caution of, okay, things are a little bit less predictable now, that we might have to respond to things in a different way than we're used to. And exercising caution of, okay, I have to kind of take a more protective stance here to make sure that I stay nice and stable.
If there's snow on the ground, you're okay. But if there's no snow on the ground, even that light dusting, you gotta be careful, because a lot of times you get that black ice underneath that light dust. And that got me one day, I actually had to crawl. I couldn't get back up, so I had to crawl over to the grass part to stand back up again. But I usually walk the dog a couple times a day. And in the wintertime, I unless the roads are plowed off really good, then I usually don't do it anymore. So, you gotta be real careful.
I have a couple of questions too.
All right.
Yeah.
Any other comments on walking on slippery surfaces, ice, snow? If not, we have another question that came in here that we're going to bring in.
So is it normal to use your stump, like, I don't know, to pain after PT is what they wrote, but they said they just feel a bunch of pain now that they're done with physical therapy. And they're just wondering, like, are they going to feel pain the rest of their life?
So one of the
And if physical therapy, I guess, did anything to prevent that pain, now that they're done, they're feeling it.
So they weren't having it in physical therapy.
And then they stopped physical therapy and they started feeling a ton of pain.
Gotcha. So one of the questions that we have is pain in the residual limb. So they asked, after I stopped having physical therapy, I noticed a lot of pain in my residual limb. And have continued to have pain since, and asking if physical therapy was preventing the pain or if there's something else going on and if they'll always have to deal with pain. And so the one thing that I want to touch on, especially if they've been in a socket, so if you've been wearing a prosthesis and things were going well, that there's all sorts of things that can cause pain, but especially early on. So when you're doing physical therapy, that limb goes through so many changes, especially in that first 6 months to a year, that volume's changing, the limb's starting to stabilize. And as we have those fluctuations, we have to manage that in the socket. And so with the socket, we are limited because it's made to fit you at a specific moment in time. And so our bodies fluctuate throughout the day, day to day. And as we're managing those volume fluctuations, we're trying to make this thing that was made for one moment in time fit you throughout all of those different volume changes. And so when you start having pain, of, okay, if it was a day-to-day thing, if one day you're like, okay, this was fitting well yesterday, and today it doesn't feel the same, of, okay, can we adjust this with sock ply? What's changed? And going and visiting your prosthetist, of letting them kind of go through and assess what's going on. Because it's a big thing with the sock ply. So it's like for a transtibial amputee. So the socket's designed to basically fit all around your anatomy. And we have reliefs made specifically for bony areas that aren't meant to take a lot of pressure. And so when those reliefs, if your volume goes down and you sit in that socket a little bit deeper, what happens is you have this kind of nice little, let's see if I can get a little pocket here. So we have like this nice little pocket, right? And if you have this bony landmark where your bone sits in this nice little pocket, if your volume goes down, what's going to happen is this bony area here is going to slide down into this relief and kind of catch the bottom edge of that relief and cause some rubbing and irritation. And so that can cause pain too. And so when we add a sock, what happens is the sock can pick up some volume, lift you back up into that nice little area of relief so that we don't get pressure around that area. There are other types of pains. If you're dealing with nerve pain and complications, there's going to be things to assess that it's always hard to say, well, what type of pain is it and what's the cause? So working with your prosthetist, and if it doesn't seem to be a prosthetic fit issue, of talking to your doctor also to see what their recommendations are, of trying to get to the root cause of that pain. But if you went from a period of not having pain to having pain, of, okay, let's try and address of what's changed since then, and see what adjustments can be made to kind of get us back to where you were.
Yeah, you shouldn't have to live your life in pain, which is what that patient was asking, kind of seeing if she's going to be in pain forever. So hopefully she can get that addressed.
Now, was she wasn't having pain during therapy, but she was having
No,
pain?
yeah,
Correct.
it sounds like it started after therapy was over. Yeah.
It reminds me of, like, if I'm doing yoga, I don't have as much neck and back pain. And if I stop doing yoga, I get a lot of pain.
Yeah, and that's happened like when you're in therapy, they're teaching you how to walk right and working on the muscles to help you walk correctly and balance yourself and do all those things. And then the second that you're not doing therapy, you're probably not being as active. That can affect your limb and your quality of life also, because just changing the way you walk can cause pain in your back or pain in your limb just just a little tweak here and there. So it's always important though to just go back to even your physical therapist or your doctor or your prosthetist and just figure out maybe why the pain is starting now. So.
Mhm.
And you touched on, so back pain too. So lower back pain specifically, that can be, I know a lot of people like won't bring that up because like, well, it doesn't seem like it's related to my prosthesis, so I didn't mention anything. But making sure too that the height of your prosthesis is correct. And so what happens is that if the prosthesis is higher or shorter, then your pelvis isn't level. And so then that can cause your back to kind of overwork to compensate for that and can cause a lot of lower back pain too. So making sure that everything's kind of aligned properly, it's fitting properly. So when you start having pain, of making sure that you are following up with your prosthetist to make sure that everything, the alignment is great, that the socket fit is appropriate, and that the height's correct. And so there's all of these other factors that can really affect your body and play a larger role than we even realize sometimes.
I just wanted to add, is that person, do you know if they're a BK or above the knee?
They did not mention,
No.
I can reread it because, oh yeah, they are RAKA. So
Oh,
right,
Okay.
right above the knee.
Okay.
Yeah.
Okay,
'Cause that-
because I was gonna, that you answered the questions perfectly, that their residual limb would change over time. I mean, even a alignment, could change if their socket isn't fitting properly anymore.
yeah, with the
Thank you.
Mm-hmm.
and then like, has anyone else experienced any pain?
And so for those of you with us, what about dealing with pain maybe during the socket fitting process? I know sometimes when a socket stops fitting well, right, that we need a socket replacement, that this is an ongoing process. It's not, you have this leg and this is going to be your prosthesis for the rest of your life. You need a new leg frequently as your body changes, because we need to make sure that we continue to fit you as intimately as we did when we first provided the socket. So I don't know if anybody else has some experiences with pain, with socket fit issues, that they've had to maybe work through also.
Well, I know I went through it, especially my first year, went through a lot of sockets. And it took probably a couple of years before it started really slowing down finally. First year was bad. The second year wasn't so bad. But then the third year, it seemed to start slowing down a little bit. And even, even now I'm 5 years into it. I'm probably going to be getting due for another socket. As far as the pain goes, it's hard. Is it uncomfort pain, or is it pain like they felt when they first got out of the hospital, or is it due to the socket itself? There's a lot of different things that could be there.
Right.
I mean, what I've noticed in my body is, as long as I stay active, as far as feeling that fake pain stuff, I know with my body, when I stay active through the day, it's usually when I sit down and relax, I'll start getting like a cramp on my toe and feeling all sorts of kind of crazy things down there.
Yeah.
But other than that, unless the sockets, I got to do add a sock or take a sock off, because it's not always adding socks. Sometimes you got to downsize. And the first couple of years, actually probably 3 years, it took me before I finally learned, hey, do this, hey, do that, as far as taking a sock off or adding a sock, or removing a sock. Because I've had times where we might have went out to a restaurant, the food was a little salty, and that got it, and it swelled me up. Just on the drive home. I being squeezed in there. But yeah, there's a lot of varieties there, things that could be causing that pain.
Right.
I guess you'd have to work with the therapist, see, or work with the prosthesis and see what's going on there, and look at the leg and see if there's any red spots anywhere, anything that's being irritated.
Mm-hmm.
Yeah, that's a good point to bring up. Like if you have a red spot, we normally say a red spot that doesn't go away at 15 minutes after you take your prosthesis off is usually going to turn into a bigger issue. So always keep your eye out and check your skin regularly just to make sure that it stays healthy and clean and no abrasions or anything. So, and never be afraid to ask questions, obviously. So.
Yeah.
And the one thing, Dave, you brought up too, is going through all of those socket replacements. So I know we have a lot of comments and questions on our Facebook page that come in frequently of, oh, they told me that I can only get a prosthesis every 5 years or every X period of time. That is not the case. When your body undergoes changes, you can justify the need for another prosthesis or another socket replacement. Sometimes the components, the foot, the knee are in good condition and you can continue to use those. But as your body is changing, then it's basically justifying the need and working with your prosthetist, working with your doctor to say, this isn't fitting the way that it was and the fit needs to be improved. So that timeline, especially early on, that we know that the limb's going to undergo those changes, and especially with diet. So that's a big thing of trying to manage some of that volume too, to maintain socket fit. That again, we have tools that we can use of wearing a shrinker. So wearing a shrinker at night to kind of help give that little bit of compression on the limb. And help kind of reduce fluid buildup overnight can make a big difference. I know, I'm sure you have patients too that come in, they're like, well, I thought shrinkers were just for new amputees.
Right. Yeah. And it helps some patients with phantom pain too, wearing it at night. Kind of, Dave, what you were talking about, where you feel your toes and things like that. Yeah. So those shrinkers sometimes help with that. Yeah.
And then same like for volume management. So we have our fitting socks, we have the shrinkers, we have adjustments that can be made within the socket of when it's consistent volume changes. So say you are always wearing a 3-5 ply, like a 3-ply or a 5-ply sock, and that's what you're putting on at the start of every day. And maybe by the end of the day, you're like, okay, now I'm also adding a sock on top of that. You can make changes to that socket and add pads and kind of continue to reduce that volume to continue to have an intimate fit in the meantime until there's enough change to say, okay, we've ran out of adjustability in the socket and we really need to make a new one to accommodate the changes that the limb has gone through. But these are all tools to use to kind of help make sure that your socket continues to fit consistently throughout the day. And especially with the sock ply, when you're going through your day and you feel like you're taking a step that feels different than the step, you're like, oh, this feels like I had a little bit more pressure, a little bit more pain, and it wasn't quite as comfortable as the last step. Maybe you get pain for like a below knee amputee, like under your kneecap or like some of the bony areas that you're noticing different pressures of, okay, I need to stop, I need to add a sock. And for above the knee of, okay, if I'm getting maybe some more pressure on that sit bone or you're noticing more movement kind of up and down in that socket, said, okay, we need to add a sock and kind of snug things up again.
Yeah, that's the thing. You can't. My issue was, you have to do that. The problem with, I had an issue with I would be doing something and I wouldn't want to stop to add a layer or whatever I had to do to take care of it. It's something you got to just, you're going to do it or you're going to end up with a sore and then you're not going to be doing anything for a while, So that's my hard-headedness, now I'm just going to finish this out and that's it. Next thing I know, I got a big old blister on my leg, and
it's not just you. There's a lot of stubborn patients out there.
One of the other things you brought up, Dave, too, so you had a ton of good points and kind of what you had said and what you shared. So thank you. And so Alexis, with you being a new amputee, one of the other things I really wanted to touch on was getting to figuring out what works and like how to troubleshoot the fit, right? So early on that learning, okay, I need to add a sock, I need to take off a sock, I need to make sure like how things feel over the foot and what changes you're going through, of making sure that you're asking questions that as things come up, talk to your prosthetist and say, hey, I'm having this, and trying to help build that toolbox together of when I start feeling this, what can I do? So that you have the tools to make sure that you're kind of maintaining your socket fit throughout the day, and that you start to become familiar with your prosthesis and how your prosthesis, your socket should fit, your alignment should feel, so that you can continue to advocate for yourself. And so that's one of the things that working with newer patients, of kind of building that common language together, right? Of here's what, when you're making alignment changes, I love to talk people through of here's what I'm seeing. How does it feel? And then I feel I'm going to make this change. It should feel like you have a little bit longer toe, or it should feel like you're falling a little, it looks like you're falling to the outside of the foot. I'm going to make this change so you feel like you're falling more evenly over the foot. And trying to basically build that communication together so that you're having the tools to tell me, because there's only so much that we can see. And I don't know how it feels inside the socket, that I have things that I can do to try and make an educated guess. But the more that you can work together with your prosthetist, this is a team. This isn't the prosthetist comes in and fits a leg and everything's great. It depends on your feedback and what you say, and being able to advocate for yourself of, hey, I have pain here, I'm dealing with this, or this doesn't feel quite right. And being able to build that communication together is huge. And so really working early on of trying to have that communication, and I think trying to relay with each other of, one, for me, using what other people have told me of, hey, this feels like this way, or it feels like I'm kicking a bowling ball, or it feels like I'm dragging my foot, of, okay, how do I relate that into terms of what's actually going on in order to fix it and make it easier to walk and make it feel more natural?
We have another question.
Okay.
So this is the same person who asked the question about exercise. They said that when they're driving, they get the urge to use their right leg, and they're in a right above knee amputee. And so like they just said, like, is there any therapy we can do, or anything that you can do to like build confidence with driving? And yeah, someone else commented like that they use hand controls.
Okay, yeah.
Yeah.
So the question is, basically it's a right above knee amputee that is not feeling confident driving, and was kind of wondering if there was any advice to increase her confidence while driving. And I know I have patients, I have a bilateral above the knee amputee that uses hand controls to drive. Does anyone else have any like anything? Is anyone a right amputee that has advice for her? Lynn?
I'm a right above the knee.
Okay.
And from the beginning, what I did was I already knew the laws and the rules to driving. So I just went to an empty parking lot, and just retrained how to drive with my left foot.
Okay.
And start getting the coordination, of driving, just like, similar to when you're a new driver, but you already have the advantages of knowing all the rules and how a car works. So that's, basically that's what I did. I just practiced in an empty parking lot and just did everything, different kinds of turns, parking, just to get, my coordination.
Right. And that's kind of what I have a lot of patients do that don't use hand controls, that they do. They did the same thing of, you got to start slow, of just the same way of progressing from when you started to learn how to drive, of using your left foot, kind of tucking the prosthesis out of the way. I have some people that take it off when they're driving if it's too in the way. But also, like, even I have some below knee patients that they like to tuck their leg out of their way, and they don't use their right their prosthesis when they're driving, even if they're below the knee, that they still use their left foot. And so you have
Right.
that control, you have that kind of sensation that you can feel where the pedals are at. And it's just kind of getting used to where the pedals are and retraining your body. So
Mhm.
as far as building confidence, Lynn, would you say that just practice?
Yeah, just practicing. And the other thing that I just want to mention is that, if you go to rent a car and you have any kind of accommodations, and it's on your license, that's the type of vehicle you have to rent. And it won't be as quick as if you just rent a regular car. So that's something to think about too. If you're traveling, going to go on vacation, and then you have problems renting a vehicle.
Right. It's a good tip.
Nate's advice is to get registered for sure, so that if you do get into a car accident, they can't hold your amputation against you.
Mhm.
Oh. And so another piece of advice is to get registered. So like retaking your driving test. So retake that driving test so that it shows that you passed your driver's test, that you can drive your vehicle, you can operate your vehicle, that your amputation is not a hindrance to you. So that if you do get in an accident, that they can't use that against you and say, oh, well, they weren't driving, or they have an amputation and it basically impaired their driving ability. That if you go and you retake your driver's test, with those adaptations, then that will hold up, that it's not because of your amputation, that there was other things kind of going on in that situation.
Mhm.
Any other?
Well, it's just like, you're relearning something all over again, even though you know it, you sort of relearn it. I drive a motorcycle, so I had to relearn how to shift, with I'm a left below the knee amputee, and that's the side I had to shift on. So I had to relearn how to do it with my prosthesis. I mean, you can do it. You just have to have your mindset to do it. I know some people it's scary, but you can do it. It just like, even though you know how to drive, you just sort of have to reteach yourself to do it a little differently, I guess.
I will say for some below the knee amputees that have a right below knee amputation, that they still drive with their prosthesis, because you can still have that proprioception, right? So you can feel the pedals based on where you feel things kind of translating up the socket. And so you're using you don't have that ankle motion to push the pedals down, that you're using more of that hip to kind of lift up at your knee and push down on the pedals, because you're not pushing at your ankle. So it takes a little bit more control, a little bit different, but again, of just retraining yourself.
Right.
So we kind of want to, we're talking about goals, Dave, before you came on too. So we were thinking we'll go through everyone and say like where you're at now, and maybe what's a goal that you would like to achieve in the future. Do you want to start?
Well, I can. I mean, I don't, my goal is just to keep on living the way I'm living, because I put it in my mind not to allow this just to, change me. All it is a new piece of me. I don't know how to put it, but so I just sort of, this is my leg and that's it. So I just continue like on, even though my below the knee's not there. I have a prosthesis that allows me to keep on going. And I still do all the things that I've did before. It's like what we just got done talking about. We ride motorcycles and stuff like that. I just had to sort of maybe change a little bit on how I did things, or relearn how to do things. And that's it. Just keep on going. Of course, I get yelled at for going up on the roof and stuff. Like, should be doing that. And
Sure.
they're probably right, but I'm sort of stubborn that way, that I'm not going to let this change my life in any way. I'm going to do the things I've always done, work on things I've always do, and just keep on going,
Right. And adaptability. I think adaptability is huge, that especially when we're setting goals, that if it's, I know with like newer amputees, or even as we start to kind of build on mobility, that there's things of, I want to run around with my grandkids. I want to be able to go golfing. It can be activity specific. And it can be certain things that they want to be able to do. It could be getting up and down from the ground, going up steps. I had a patient that came in and he wanted to be able to weed whack. And looking at these activities of, it might look a little bit differently than before the amputation. And saying that, okay, how can I do this in a way that I can do this activity and feel safe about doing the activity, but continue to be independent? And I want to get back to doing this. And so kind of looking at how can I adapt this in a way that I'm able to do this? Because I think that's a big thing. Like what you had talked about, that you're like, I'm going to keep doing the things that I want to do, but it just might look a little bit different.
Right.
And I know some of you that have joined us in the past, one of the things that we always say, it does take about 2 years to optimize your functional abilities on your prosthesis. And so in those 2 years, that's when you're really putting in the work to kind of build that function, that it's not going to take 2 years necessarily to be up and walking again, but 2 years to get back to where you were before your amputation. So that's kind of in general, what we find with patients is that in those 2 years, that's where you're getting back to your same kind of level of ability.
Just don't get frustrated, There's gonna be times where things aren't working out your way. Just hang on. Don't get frustrated. It'll work out. It'll work out. Don't give, keep doing what you do. But it like what we talked earlier about talking, your prosthesis people are going to be your best friends, because you're going to be seeing them quite a bit. And because if you have an issue, you need to get it taken care of right away. If something doesn't feel right or fitting right, that's the main thing. So
It's like your family.
they are.
I
They
know
are.
that they're never bothered when you call.
I see them more than I see my kids.
Well, there's something wrong with that. Oh, no.
But yeah, I think one of the other things, so seeing your prosthetist and having that relationship, I know I have patients that come in, they're just like, well, I didn't want to call, I didn't want to bother you. That's our job. That's what we're here for. We are here to help you maintain your mobility, to keep you out and about and doing what you love. Like, we are not at all ever concerned that, oh, so-and-so is calling again. Like, I can't believe, no, we love it. We're like, oh yeah, I'm glad that they're calling. I was wondering how they're doing. And I know I think about people all the time. If I haven't heard from them in a while, I'm like, oh, it's hunting season. And I know so-and-so is probably out in the fields. And, so just make sure you have a relationship where you can reach out to your prosthetist and build that connection, that you're not a bother. It is our job to help you. And if you have an issue or there's something going on, call and reach out and get an appointment and work through it together. Because you're not alone in this journey. And we want to make sure that you have the tools and the resources to help you kind of maximize your ability on your prosthesis.
You should never feel like you're a hindrance. If you feel that way, you should maybe go get a second opinion. It's like,
I was
we're
going
here
to
for
mention
you.
But that's true. I mean, especially in the first, if you're a new, it's really tough. Yeah, because I've been to the office twice in 1 week sometimes when I first had my amputee. Trying to get it right, and they worked with it and got it. So.
Yeah, I think the more willing you are to come in, the more frequently you come in, the better your care is going to be in the long run. Like, it takes longer with some patients just to get it right. And, we can't do anything unless we see you. So.
And I had a sort of unusual stump. My leg was unusual to start with, but I had to go back. Like I said, I had to go back a couple times, and sometimes when you're there, everything feels great. And later on during the day, especially when you're new and you're not sure what to do, so don't be scared to call them up and say, hey, this is going on or that's going on, so.
Dan, it's easy when you're in the office and you're walking on a nice flat level surface and a nice controlled environment, and we're making changes that, sure, things might immediately feel better than they were, especially if you came in and you had pain and we're making a relief or making an adjustment to the socket fit, to the alignment, that they could feel better than they were walking out. So you're like, okay, yeah, I think that fixed it. But then you have patients that call a couple days later and you're like, I'm still feeling this area. It still doesn't feel quite right. And so just because it felt better at the end of an appointment doesn't mean that the problem is solved. So it can be an ongoing kind of troubleshooting process of making sure that we get to the root cause of the issue. So good. And Patty, I wanted to circle back to you also. So what goals do you have set for yourself, or would you like to set for yourself?
I would love to get off the crutches. Would be my goal, to get to a cane, or like I said, even the one crutch would make it much easier. It's so hard even around the house with the two crutches to do anything, because you're putting the crutches down, they're falling on the floor, you're picking them back up. It's just, it's annoying more than anything.
How long have you been an amputee, Patty?
A year and a half.
Okay.
So I got 6 months.
You
I'm
got
just
6 months. No.
Exactly. I'm setting my clock.
Oh.
I did have a question though. On my prosthetic, I have one of those BOA dials.
Okay.
Does that keep me from having to use socks? Because I've actually never used socks. They gave them to me in the beginning and I've never used them.
I mean, the BOA can tighten so much. And if you need the socket to be tighter beyond what the BOA makes it, I can see the potential of maybe using socks, but yeah, that's kind of what that's for. The BOA is just
Okay.
to tighten up the
That's what I
socket for you when you need it. Yeah.
Okay, and I know during the day sometimes I will tighten it, and I don't
Yeah.
feel like I've ever needed more than that. Okay, I was just checking.
Yeah. What suspension do you use? Like a lock, a pin lock, or a suction?
Suction.
Okay. Nice.
And I've actually have not gotten a new socket. It's the same socket from the very beginning. Is that unusual or?
As long as you're keeping suction and it's fitting well, like,
it
are you
is.
having, yeah, so that is, yeah, it's not like a set rule, like, oh, you have to get a new socket in 6 months after you get your first one. It's
Okay.
just, yeah. Yeah, if it's fitting good and you're happy and it feels right, then you're good to go.
Okay, thank you.
Yeah.
I do, just with Patty too, I want to reiterate, getting back in physical therapy and talking to your prosthetist, talking to your doctor, that this is a goal for you, and working on that balance of being able to kind of balance with, like if you're in the parallel bars, to put that weight through the prosthesis and feel comfortable, to feel like you're supported, to be able to kind of progress. Because I know, like, going from a walker or bilateral forearm crutches makes a big difference to go to a cane, because now you have a hand that's free, that you have a hand to help balance and support yourself, but you have a hand to kind of help grab and carry things, to interact with things around you. That is a big jump. Just in terms of an independence and being able to kind of do a little bit more around the house too.
Oh, absolutely. What I've been trying to do when I walk with the one crutch, because what I found was when I was walking with the one crutch, I used I'm a left, above the knee left. I was using the right crutch. My left arm, like I wasn't moving it at all. It was just kind of hanging by my side. And it was actually a friend that was here, and they're like, maybe if you swing that arm a little bit, it might, and that feels better, but I have to really focus on doing that. It doesn't come naturally to swing that arm.
Mhm.
Right.
And so that's where like physical therapy, and so the pelvis, right? So we have this kind of rotation in our bodies that with our arm swing and our hip swing kind of in the same way of making sure that we're not compensating in order to make yourself feel less stable. And so that is pretty common to kind of protect that hip and not drive forward with that hip as much and
Okay.
losing some of that rotation. And so again, that's where physical therapy can make a big difference and just kind of going through some of that gait training and creating those good habits. And one of the things, so they'll give you a lot of tips and pointers and exercises of things to focus on. And we do the same thing here in the clinic. We do it during Step Up. Of trying to go through this, and it's good gait habits, but there's people that are like, this is great, Abby. But it's so draining to focus on this all the time. Like it is exhausting to think about how I'm supposed to walk. And so it's one of those when you're walking into a store and you're focusing on it, or you're walking in the hallway, spend a little bit of time each day. If you have a nice kind of long hallway or path in your house, to just practice, hang up a mirror and watch yourself walk and see where is your body falling? Where's your weight falling? Do you look balanced? Do you look stable? And you can catch yourself doing maybe a lot. If you have a lot more gait deviation. So like some people, if you hike up your hip in order to clear your foot, if you're circumducting and swinging that leg out to the side, and watching yourself as much as you can. When you're walking into stores, in the store windows, on the video cameras, mirrors in the hallways, because that's going to help your brain kind of see what's going on also. But the more that you do it, so for those short distances, okay, I'm going to practice for a little bit of time and I'm going to practice walking well and in the way that I'm supposed to, but you're in a rush and you're trying to get from point A to point B, that's going to go out the window sometimes. But the more that you practice that, it's going to continue to reinforce those good gait habits. And then before you know it, that's going to be how you're walking the majority of the time. Because I know, I have a lot of people say that of just, it's exhausting to think about it. And it's with anything, with a sport, with any activity that you're doing, of you're thinking about your form, right? Like I was a tennis player. And I remember growing up even of, okay, you got to like set your stance and do this and drop your racket and like turn in a certain way. And you're like, I have all of these cues that I'm thinking about all the time. And then you do it for a few years and you're like, oh, okay, this feels more natural. Like I can't believe I used to think so hard about this.
Well, and it's funny because when I'm walking with the one crutch, that's how I am. God forbid somebody talks to me. I'm like, don't talk to me. I'm walking.
One of them that can't walk and chew gum at the same time. Huh?
Exactly. Yeah. Yeah, exactly.
All right. And I see Bernard, you joined us here. We were talking about goals a little bit today, and setting goals and maybe some outcomes and how do we achieve goals. But if you want to introduce yourself to the group here quickly of who you are, where you're from, how long you've been an amputee. Oh, and you are muted, so I'm going to have you unmute yourself.
Unmute. I don't know how that happened. You can hear me now?
We can hear you now, yeah.
Yeah, again, my name is Bernard Cates. I live in Portland, Oregon, and I've been an amputee for 2 years. I've had my prosthesis for a year. I'm OI, osseointegration. So I really don't have too many problems with my prosthesis. I just thought I'd join in and see what's going on a little bit. I don't have problems really with my prosthesis hardly at all. I have problems with my leg, but not the prosthesis really.
Good.
You probably don't have too many OI people.
They are far and few between, but I know that some of the clinicians in our practice have worked with a couple, and with it being approved by the FDA recently, that we do anticipate we'll see more of them. So it's good. We have a couple people here that I know are undergoing consultation of getting the limb kind of prepped for OI.
Yeah, because like I met with a woman yesterday who had a socket for about 4 years. And a lot of problems and stuff, and she just had OI done about 4 months ago. So she'll probably start using her leg in a week or two.
Awesome.
Yeah.
And just to kind of reiterate for everybody else here too. So OI is osseointegration. And Bernard, do you want to talk about maybe your experience with it a little bit?
Well, I've never had a socket. I was in a bad accident 2 years ago, and my stump is really super short. I like a femurette. My femur is very short, and I just never, a socket never would work. So I got OI right away. It took me a while to find out information about it, but I had it done in New York. It's not done in too many hospitals in the country. And again, I don't have any experience with sockets, but and I don't mean to downgrade any people, or I don't know, I'm not saying the right words, but I really have no problems with my prosthesis. I literally put it on in the morning when I wake up, and I take it off before I go to bed. If I have to get up in the middle of the night to pee, I put it on, go to the bathroom, come back. So that part is really good. My problem is and this isn't why you're talking here today, but my stump is so short that I have very little muscle in my leg, and walking up inclines is impossible for me unless I have a cane. But again, I know this whole thing was about your prosthesis and stuff, so I don't have an issue. I'm just here to listen. Okay.
Mainly goals.
I'd say,
Yeah, it's just goals. Yeah, we're just talking goals, and I mean, you have a prosthesis and you don't have a socket, but you still have a knee and a foot and all that. So, yeah, your feedback's great.
And a goal would be walking up incline.
Yeah, and that would be a goal for sure. Walking
What's
up inclines would be a good goal. And
Well, it's a goal, but I mean, I just don't, there's no muscle there. My stump is so short that I have very little muscle. But I'm willing, any people ever have questions about OI, I'm so positive about it, so pro about it. It's really a very good thing.
Yeah, I have a patient that just recently received that, and he's very happy too.
Where did he have it done?
He's a veteran, so at the VA hospital, yeah.
Down in Walter Reed?
Yeah, yep.
Yeah, because I don't know, but there's only a few hospitals in the country right now that are doing it.
Yeah, yep.
Okay.
And then Antoinette, I saw that you joined us as well. So we've been talking a little bit about goals and just kind of some other questions that came up. If you don't mind introducing yourself, your name, where you're from, how long you've been an amputee.
Hi, I'm sorry. The time got away from me, and I've been literally waiting all day for this. But I do apologize for being late. My name's Antoinette. I go by Tony. I'm in Lawrenceville, Georgia, right outside of Atlanta. I've been an amputee for November will make 2 years after a bout of sepsis. I am a right above the knee amputee. I originally had a suction system, but now I have a pin lock system. And I just got that like 2 months ago, and I actually like it a lot. I didn't like it in the beginning because it's a little bit bigger with the pin lock on the side, but like functionality, I really like it a lot. The only question I have, and my daughter and I sort of figured this out, is my liner. I could never get it comfortable. We cut it every way you could possibly think of. So we ended up like leaving it, the second one sort of long, and folding it out over.
Yeah.
I think I saw somebody on YouTube, and my daughter remember hearing somebody said they do that. So do you guys have experience with that?
Lynn, do you have
That
any
issue?
advice with that? You also being above the knee?
Yeah, I've folded the liner over the top edge as well. So
Okay.
that had worked in the past. Are you getting pressure on the edges of the socket at all?
No, you mean the bottom?
The top of the socket, where it
yeah.
comes up high.
no, that part is okay. The problem is like in my inner thigh, like no matter how we cut the liner and then the sleeve, it would, end up just really aggravating my skin.
Oh, okay.
And so that's when my daughter like tried to do everything possible. And my daughter said, Mommy, let's just try to fold it over.
Mm-hmm.
And yeah, it's been much better, but they didn't suggest that when I got my my new socket at all. I was sort of shocked.
Yeah.
And so that socket, so that trim line kind of right through the middle, through the groin area,
Mm-hmm.
does that come up pretty high and contains all that tissue? You don't get like a little kind of tissue pooch out the top?
No,
Okay,
no.
good, good.
Yeah, yeah, no, mine it's pretty good. My residual stump is it's not small actually in comparison to what I see with some people, but no, that's not a problem at all. It's so much better now. I'm just, like I said, a little bit shocked that nobody mentioned that to me.
Yeah, if
to
you're
try
having
that.
issues and stuff. Yeah, that's why this is it's a good thing what we're doing right now. Just, talking to other amputees and seeing what they've tried. So
The other question I have for her, I'm sorry, I forgot her name. I use Desitin on my skin. Can you ask her what do you use on your skin before you put your liner on?
I use I always want to say Orphatrans, but that's plastic. Aquaphor.
Oh, Aquaphor.
I use
Okay.
Aquaphor, but a very, very thin layer. And then what I do too, as at night as well, I put it on at night.
Okay.
There's only certain spots. I was in a motorcycle accident, so I have very deep scarring. So I do put a little bit of the Aquaphor into the scarring area, very thin layer. But
Okay.
basically, I found that really is helpful on my skin.
Oh, okay. So I thought about the Aquaphor, but they told me Desitin, but I was thinking something like Aquaphor because they're probably like basically the same ingredients when you break it down, but Aquaphor probably is a little bit cheaper too.
Yeah,
Aquaphor,
because
Aquaphor is, like Vaseline.
Yes.
And it sort of, Lord, it sort of lubricates, where it's Desitin is sort of like a barrier, for babies, for urine and stuff. So I don't think it'd be as much of a lubricant.
Okay.
That's just my thought.
Yeah.
But the Aquaphor, like I said, during the day when I have my prosthesis on, I use a thin layer only in the scarring. At night is when I put it on in different areas, because you don't want your liner to come off, slide off.
Yeah.
And slide and right.
Yeah. Okay. And then the other question I have, if anybody have a running leg.
I don't.
No. Oh,
No.
I have a running leg. I just got one recently too. And that's sort of a big adjustment. I feel like I have to like kick my leg out with it.
mhm.
Is that generally how it works?
So do you have a knee on your running leg?
No.
And that can make a big difference. That I've seen people where they keep the leg straight, and then what happens is you don't have that knee. So to compensate for the length of it, you do kind of circumduct a little, right? So that leg's kind of coming out to the side in order to clear that foot. Because otherwise you have no way to kind of drive that leg forward. If you drove it straight forward, then you're going to catch the bottom of that, which you catch the ground going at a fast speed, then that's going to end up in a pretty hard fall. So there's kind of two different options. But I know circumducting, if you don't have the knee in there, that's a pretty common deviation that you're going to have when you're running.
Okay.
So there are specific knees made for running prostheses that have kind of low friction, so they snap out pretty quickly, so you can drive that leg forward and that knee snaps out, and then it's ready for when you take that next step. but kind of working and kind of going through, did your prosthetist work with you at all too on kind of how to drive your limb like through the socket when you're running?
A little bit we did. I actually had it done in Orlando, Florida, and then I came back here. So I didn't have a ton of time when I left. So I do have to kick it out. To be honest with you, I actually feel more comfortable because my knee itself is a C leg. So I actually, I thought I was just gonna be a world-class runner when I got my running leg, but I prefer the C leg, just doing the treadmill in my C leg. And then I could put the C leg in cycle mode if I'm doing other things too.
And that's one, I know a lot of people make the comments, or I'm sure that you've had sometimes people come up and like, wow, like technology has come so far these days, and how great. And it's not, at the end of the day, the prosthesis does not walk for you. It does not run for you, that it still comes down to you putting in the work, that it's not powered. It's not going to automatically help you walk or help you. It still takes a lot of time and persistence and patience. And there is a lot of hard work behind the people that walk with a nice stable gait, that are running, that are athletic, that are doing all of this. It's not an advantage from the prosthesis. It's a lot of hard work and patience and dedication that has got you to that point.
Yes, 100.
So, and Tony, one of the other things that we were talking about today too is kind of talking about some goal setting of what do you like activity wise, what we want to get back to, looking at goals. Because one of the things we have in clinic all the time is people come in and they'll, after a month or so, especially early on, of just feeling like they stagnated, feeling like, hey, I feel like I'm not making progress. I feel like I'm not getting to where I want to be. But then sometimes from an outside perspective, like I hear people say that sometimes. I'm like, gosh, like, but you're doing so good. And I saw you come in with your cane this time, or I saw you do this. And like, you're walking up more straighter, you're taking longer steps, your base is narrower. Like there's all of these things that we can pick up on. It's like, no, like you're making so much progress and you're doing so well. And just trying to reframe that a little bit. And so kind of talking about some goals. And I wanted to ask you if you had any goals that you had set for yourself, or things that you'd like to accomplish in the near future.
Yes. One of my, I think, bigger goals is, because I was so sick when all of this happened to me, is just stamina. Like I really want to be able to, Stone Mountain is down the street from me. I would love to go back there and just walk around the mountain and not feel winded or just exhausted. So stamina, and to maybe start a little bit of hiking again.
And so when we set those goals, when we have a big goal like that, kind of breaking that down into some smaller goals, right? Of, okay, I want to get back on the bike and I want to be able to bike for this distance, or I want to be able to bike at this resistance. And same with walking. I know you mentioned you've been on the treadmill. Okay, pushing yourself just a little bit further. And when we're making that progress of knowing it's not always going to be linear and things are always getting a little bit better each time, there's going to be some bumps in the road, and we want to just make sure that we're trending upward, that we're going to have days that not every day is going to be better than the last day, but over time, we want ourselves to be a little bit better than we were the day before. And so measuring goals, how do we measure goals?
Listen, guys, I'm going to leave now, okay?
All right, thanks for joining us, Bernard.
Thank you. Bye.
So how do you measure goals?
Well, I don't know. Why are you gonna ask me a question like that? No, I'm just kidding.
Well, it's not ask me anything. So I think there's a couple of different things that we do, right? So we have, when patients come with their goals of these very pointed, I know Patty mentioned, okay, I want to get rid of the forearm crutches. I want to go to a cane. And Tony, you're like, okay, this is my goal. I want to be able to go up to Stony Mountain. Okay, we have our patient-centered goals, but then there's also things that we can look at as prosthetists. and maybe having some outcome measures. So I know that sometimes maybe you come into the office and we're like, hey, we're going to make you work today. And I know my patients always love when that's the answer.
Yeah.
I got to make you get on the treadmill. We're going to walk for 6 minutes, and I'm going to have you do all of these little tasks when we're doing the AMP. So I don't know if you have in your clinics, have you guys had experience kind of doing like what's called, the most common one I would say is probably the amputee mobility predictor, or the AMP, where you go through a set of kind of certain tasks of, okay, we want you to sit down in a chair. We want you to sit unsupported for 30 seconds and pick things up from the floor and walk and kind of do all of these different things. So if you had experience with where you go of them doing some of these different outcome measures is the fancy term, but tests.
I've had that in physical therapy.
Okay.
We've done a lot of that actually.
Yeah, that makes sense because they're value-based care.
And do you know specifically, like, does that sound familiar, the AMP?
I don't know if that's what she called it, to be honest with you. But we did, like we do every so often, like the 6-minute walk. And yeah, different things. I don't think she labeled it, but yeah, we do certain things there.
Good. How about you, Patty?
I haven't done that at all, actually. No.
And so that's one that it can give us just a little bit more kind of information of seeing how we do over time to track progress. And so like the 6-minute walk is a popular one. There's a lot of data that's standardized for amputees that we can see how you compare to a certain peer group. But basically going through and getting some sort of metric. So it's not just an objective of, you know, Patty came in today and she looks like she's doing this and looks like she's doing better and seems to, it's no, okay, I can say that I performed this specific outcome measure at this time, and then a month later did it again, and we've shown progress. And over time too, that as it's, again, we talked about this, right? It's not always linear, that sometimes we're going to have days where things decline, and especially with socket fit. So socket fit, or as you start to plateau on certain componentry, especially early on of, okay, how can we get us back to where we were at the start? And we want to continue to see growth. And maybe once you've reached that area of growth where you are doing the activities that you love and you're kind of to the point where, okay, I want to maintain this now. If we see a dip in that of, okay, how do we get back to this? So outcome measures can be a really great tool to use to help us kind of see how patients are progressing. And then also talking about goals and strategizing kind of with the patient and with physical therapy of how do we get you back to doing these certain activities or to changing the level of assistive device.
Yeah, and we use those tests to kind of predict our patient's K level. Have you ever heard that be used? It's like your activity level, and we base the components that we would recommend for you off of that K level.
I know my prosthetist did that when I first went to him,
Okay.
but I don't think the therapist has.
Okay. Yeah. So, like if you're starting out, especially for an above knee amputee, like, it just depends on the person, but you would start maybe at a K2 and just say that you're just going to walk around. You're not going to do anything, just basic. It's called like your basic community ambulator. So you're just going to walk the same speed for a certain amount of time and just do daily activities, nothing above ordinary. And then like a K3, and then that's how we use these, is then we can predict that, oh, you're doing more activities now with this prosthesis, and now you can get something that maybe is better for higher strenuous activities. And that's kind of what we use these outcome measures for, to give you a better quality of care and give you the components that are appropriate for you. So.
Then I think appropriate component selection is key.
Yes.
Because it doesn't necessarily mean better. It means what's most appropriate for you where you're at. So some of those components, like some of the K2 feet, are going to be more stable. But you're also not going to get the benefits from like a carbon fiber foot at a K3 level, because some of those feet require you to walk at a faster speed and to actually put the force through them in order to get the benefits from them. Otherwise, it's just going to feel really stiff and you're not going to get the benefit from it, that it's not going to be as compliant. So appropriate component selection is really the key there, that it doesn't necessarily mean you get something better. It's you get something that matches your level of ability and where your functional level is at. So when you're at like K1, K2, and you have something that's a little bit softer and more compliant, that it's going to give you a really stable base. It's going to help you in those environments, but putting you in something that's maybe higher could be a detriment to you because you're not going to actually see the benefit from that specific component, like the foot or the knee.
Right.
So I like that word choice. That's a good choice.
Yeah, like with above knee amputees, we'll start with a very stable knee to begin, just to teach the patient to walk and learn how to bend the knee, and then give them a knee that you can wait and you're not gonna fall, and just teach them how to do basic ambulation with that prosthesis. And then normally with your second one, if you're doing really well, we're like, okay, now we can try you with something that gives you a little more movement and a little more like feedback. So
Tony, with your first prosthesis, did you have the C leg on the first one, or did you have a mechanical knee?
No, I had the C leg with my first one.
Okay. Just curious.
you were pretty active before your amputation.
Yes, very.
Yeah.
And one of the things we talked about, Tony, earlier too, was physical therapy. And I know I think you mentioned that physical therapy did some of the outcome measures. So you've had physical therapy kind of when you first got your prosthesis, correct?
Yeah. Yes. And then we had to interrupt it because I had multiple surgeries and so on and so forth. And I've been back in physical therapy very steady for the past at least 6 to 9 months. Yeah.
Okay, good.
Mhm.
Good. And I know, so we were kind of talking about the outcome measures earlier too. I know you and Patty both mentioned that they did these in physical therapy, which is great. Like, we love physical therapy is kind of this non-biased party that not to say that prosthetists are going to skew things, but when we're trying to justify and say, hey, I think that you need to be at this K level to get this foot or this component, that it definitely helps having that information corroborated with the physical therapist, because they're seeing your level of functioning, that it's somebody else that's evaluating, that is not involved really in your prosthetic specific care. And so having them perform those outcome measures too is very helpful. That it's great to see kind of more of that utilized to, again, give some sort of objective measurement of kind of where you're at and how we're progressing.
Yes, and they do communicate. There have been times when, they've talked to each other about certain things, and she may say to him, you may want to do this or make adjustments and so on and so forth. So yes.
Good. Love it. Yeah, that's the way it should be. I love when we get to work with the physical therapist and you have that team approach to it.
Mhm.
That's the best solution, because you're getting people that are there to kind of focus on all aspects of your care. And you have a team approach of, sometimes it's things of, if they come to us of, hey, we need to tweak the prosthesis, we need to make some adjustments to the alignment or the socket fit, or they can notice things and come back to us, or us going to physical therapy of, hey, I noticed that maybe this seems a little bit tight. And being able to work together to really help you achieve your goals, that's huge. So I'm glad that that's the case, because that's not always the case. And I always love if I go to physical therapy with a patient and get to meet with the therapist and kind of work through things together. It's awesome to have that team approach to care.
Mm-hmm.
So what other questions do we have about goals, or questions in general?
Yeah.
We got some questions.
Okay.
So what does the first 90 days of your amputation journey look like? So somebody asked, they want to hear like people's stories of recovery.
Okay.
And so like they asked, how long were you in the hospital? How long did it take you to get fit for your prosthetic? So can you talk about like that first 90 days or whatever the big chunk of time is to kind of demystify some of that?
Okay. Yeah, we have someone that wants to know what maybe the first 90 days after your amputation looks like, as in like, how long are you in the hospital? How long before you got your first prosthesis? And what recovery looked like for any of you guys. Does anyone want to share their specific journey with that?
I can share briefly. When I think in the hospital is when I first met my prosthesis person. He came and introduced himself, and I think he gave my husband some shrinkers while I was in the hospital. And I can't remember if I started wearing them then or when I came home. But anyway, I started wearing the shrinkers. I was very fortunate. He actually came to my house when I came home and started measurements and just sort of, it was a lot of education in the beginning. I think like trying to prep us, and he would take my measurements and he made a few casts. And I think my process was a little bit longer just because of some other issues I had going on. But for the most part, I wore the shrinkers for quite a while. And then, like I said, he made the cast, and one day he came and said, "Here's your prototype." I was like, "Really?" And, and I had home physical therapy who was working with him as well. And yeah, I remember standing up that first day, and we went through quite a few test sockets until we sort of got it right. And yeah, it was from there. So it was a very, I wouldn't say easy process, but it was pretty smooth in the sense of he was very good at telling us every step of the way, these are the things that can happen. Mm-hmm. The one thing I didn't anticipate is one time, I think I got a new socket. Yeah, but the first time I could really wear it, because I had to have some more surgeries, I had my mom take me to the office. I was so upset. I said, "I don't know what's going on. This leg it feels so heavy. I'm just not doing well. I can't walk." I was in tears. And he was like, "Well, did you guys charge it?" I don't know why we had all forgot to do that for some reason. That has never happened again.
Thankfully, it was an easy solution, right?
I know. I think we were just like my family. You know how in that moment we're still in this shock of everything that happened and trying to dot our I's and cross our T's so much that we literally just did not charge the leg. So yeah. And I mean, I remember telling my mom, I'm a nurse. So I said, "Mom, I must be in heart failure or something, because I just can't do this. This is so heavy."
And I do. So one of the things you kind of touched on a little bit of, there was a couple like complications, right? So there was a little bit of back and forth as you continued to move forward. And one of the things I always love to tell people, this isn't a timeline. I can't say that it's going to take 4 weeks, 6 weeks until after your surgery that we're going to start the fitting process. It is an event line. So we have to make sure that the limit's healed, that we get the approval from the doctor, that the incision looks good, and that they're like, okay, we can start fitting the prosthesis, or we can start with the shrinkers. And so starting with the shrinkers, you might have shrinkers when you have the sutures or the staples still in, to help kind of give that limb some compression, and help with the swelling and keep the volume down and start to stabilize that volume a little bit. And then kind of help things continue to heal until you can start the prosthetic fitting process. And then even that, I know you mentioned kind of several test sockets of going through to make sure you get it right. Again, it's an event line. It's when the socket is ready and it's fitting appropriately. Okay, then we're going to finish it up and send you home with it. We're looking at all of these different milestones, and sometimes it can be hard to put a specific number on things because there can be complications that, whether it's things are healing and there's risk of infection, and then that delays things. Sometimes I've had patients fall when they're waiting for their prosthesis and to start that, and they end up, the wound opens back up again and they have to let that heal and start that healing process. And so kind of continuing to show yourself grace during, especially that initial period of all of a sudden that this is a big change to your life, and you're kind of waiting on that. Okay, I want to start being more mobile and I can't wait until I can stand up and I can start walking again. During that waiting period of showing yourself grace of what you're doing also, of, okay, in this time, my priority is letting my body heal and continuing to move forward. And that's what I can do. The only thing that I have control over right now is kind of that timeline, and showing yourself grace as you move through that process and being patient, because I know that it's hard and challenging, and that it is. It's a little bit of a waiting game in the beginning, of kind of waiting for all of those events to fall in line until you can start the fitting process.
Yep. That's definitely, it is a question that I feel like we get asked a lot. It's like, okay, how many appointments are we going to have? How long is this going to take? And all that. And it is so different for every person. So, yeah, it's good to just, like she said, give yourself grace, give it time. The more time that you spend with your prosthetist, the better outcome that you're going to get. Make your appointments, go to your appointments. That's the best advice from me. So,
and I'd say in that time too, I know Tony, you had mentioned they were talking about kind of what do those next steps look like. Providing information, giving you the chance and the space to ask questions is huge. That when you're working with somebody, you want them to be able to be there for you as a resource to answer questions. And there's a lot of unknowns at that point. And so I always encourage people, hey, reach out, call. I don't care what the question is. I'm happy to talk to you. I would rather be able to have a conversation and provide information and help you through this in any way that I can than have you sit there and panic for a few days because you felt like you couldn't reach out to me. And so I think that's huge to be able to have that relationship, to call and reach out and ask questions of what does this look like? What comes next? How do we keep moving through this process? And I see consistency is your screen name. I don't know if you want to kind of chime in and introduce yourself also. We've been talking a little bit about the initial journey after amputation and what that looks like for a question that came in online.
Hi, hello. I just got off of work, and so I wanted to come join in. I'm a OMP assistant, and I used to be an engineer and stuff, so I like the field. I like helping people. I see more people than when I was a pure engineer, when I was just had like 18 screens around me for, 10 hours a day. You get your eyes get burned, and then you get like, what am I doing? It's like something, gazillion dollar, So I'm learned from some people who are very, very good at thinking ahead with casting in particular. And so we wind up, we went through something of a drill sergeant experience. It's like, all right, pretend you have to walk on your fingertips, learn how to bear weight. That's basically a big focus. Mm-hmm. But without getting too far off topic, I've been disappointed in a lot of different technologies, especially 3D printing. I've used that a couple times for Procter & Gamble. Were the ones that were most interested in it for prototypes they had. But I feel like just some unusual people getting in the space made it very difficult to make the things really viable or really really reliable. So I laugh at that. So sometimes we'd give up on 3D printing, just go back to 5-axis stuff. But yeah, so I'm just jumping in here in the middle of things. So I'll get off and let you. I'm sorry, what was the subject you're talking about supporting people?
So initially, I mean, today we're kind of focused a little bit more on goals. One of the questions that we were just discussing when you joined in was kind of initially after an amputation of what does that journey look like, kind of the first 90 days. And so we had a couple people share kind of their journeys, and then we're talking about our experience and what that looks like, and kind of what to expect from your prosthetist and availability too. But yeah, I know as far as technology goes, just to touch on one of the things you said, particularly like with 3D printing, I think one of the faults of our field is that we don't have a lot of standards in order to compare sockets, right? So we have this new technology, we have all of these new things coming in, and there's no standardization to say, I make my sockets in this way, and I can say that it's stronger than this. It's all anecdotal. So there's no hard
none
evidence
whatsoever.
and there's
And
no
that
hard
comes
evidence to
downhill
compare.
because the osteo doctors have no real standards for amputation sometimes. And you can't complain. You never speak in work, you never speak against that, but whatever direction the femur got cut or whatever is what it is.
Mhm.
And, so then you just think about where the pain's going to come from. You want to think about like, okay, is this real phantom pain? Or is there some sort of a pressure point, or is there other damage far up the nerves?
Mm-hmm.
You think about, okay, so it's not just flesh that the femur or the tibia or what have you is poking. It's good. There's different muscles. There's the sartorius. There's different ones that have to slide. Muscles don't just flex. They slide and they bend and and the so there's no standards compared to anything else in medicine. There's nothing. It's all just, I feel this way or I feel that way.
And so that is thankfully people are acknowledging that and starting to say, okay, we need to start having the research to back up why we're doing things the way that we're doing, and maybe start to question and challenge ourselves a little bit more, especially as we're kind of encroaching onto some of these newer technologies. So I do think that there's a lot more happening, just because there has been kind of this chasm and loss of knowledge over the years, that everything's been translated and we know why we do things, and we know the theories behind it, and we know what we're trying to accomplish, but it hasn't been recorded in a way that we can kind of keep track of it over time. So I think that is one of the things that we're seeing a lot of, and we're seeing a lot more research kind of in certain areas in order to create some standards and set of consistencies and expectations. And especially with goals, like we're talking about the outcome measures of, it's nice to have that standardized data now, that if we say we're going to continue to use these outcome measures, that we can perform that in the office and then compare them to their peers and say, hey, you're doing better. You're in the 75th percentile. You're doing better than 75% of your peers with the same cause of amputation, level of amputation, age group, and start to kind of draw some conclusions.
I wonder if that's gonna hinder some people with feeling like they're doing well too, because everyone is so different. So if we're putting people into percentile boxes, to his point, every surgery is different, and there's not even like guidelines for that.
Right.
And so like, just because, even the way that a surgery could go, every residual limb is going to look different, and that's really going to impact how someone recovers with rehabilitation. And so I would think about that too, of like, now if we're putting people in percentiles, that could be
Right.
that could be limiting.
Right.
Yeah.
I'm sorry to also feel not too excited about doing statistical bell curves or t-test curve, whatever, but I already have a database, an SQL database of that data for my corporation, which you can probably guess which one that is. But like there's another gentleman who is just on the Reddit page. I came here from the Reddit group, and that gentleman he talked about, well, I made 500 steps and then I couldn't walk anymore in my new prosthetic. And I'm like, okay. And then I see his wound and I'm like, oh, I know. I bet that prosthetic is just letting him, I bet that thing's as smooth as, as a, just as smooth as a Tupperware, And sure enough, you can go back and see that conversation. And sure enough, he shows it to us. And yeah, so it's just whatever, it's completely smooth. But I mean, if you give him an A, B, C, D scorecard, he's just going to take a few more steps so he feels like he's trying hard.
Right.
And I think that's the thing of going in. So if you're using outcome measures and sharing that with the patient, and we're trying to set these goals of, we want it to be productive. We want it to be a positive experience and to kind of show progress, or to show growth, or to show, okay, you know what, we've changed a little bit. But again, it's a number. It's not we don't want to push you to the point of you have to walk 10 more steps and kind of walking behind you, try with a blowhorn, trying to get you to perform well. We want to track this over time so that we can see how you're doing. And then compared to peers, that maybe there is a reason, if we're looking at data, whether it's the level of maybe the length of the limb or complications that they've had, or nerve pain, or if there's something else going on, of seeing where they've fallen, if there's reasons for that and what can be done about it. So it is kind of a hard conversation to have, of looking at where do you fall in comparison, but using that overall to track that individual person's growth, that it's not to say, oh, well, you should be up here, that sometimes there's a reason that we're not at the same level, or that we're a little bit lower, and using that to kind of go through and guide their care and guide their progress, and say, you know what, sometimes with a lot of things, it's a number that we're looking at for a goal. And we want to see where you're at now and your progress. And so trying to track that and maybe reframing it a little bit too.
I think when you put it like that, especially, it's so powerful, because we're showing people like, okay, when you first came in, your goal was just to stand. And then it became, I just want to be able to walk. And now you want to be able to get on the ground and crawl with your grandchildren, and like showing people that stuff too. That's maybe not like as typically measurable, but now we're being required to measure it.
Right. And so you're going to have some of those outcome measures that are more data driven. But those goals, the goals that you come into our offices with and you say, I want to do this. I want to ride my bike up this mountain. I want to go on a hike. I want to be able to play with my grandkids. And when we can see that growth, then those are really the goals that we want to dive into a little bit more, because that's your daily life. That these other ones can affect that and affect your mobility and your stamina, and are kind of some predictors of some of that. But it's really those individual goals that are absolutely key, that those are always going to be a huge, huge, very important piece of the puzzle, because at the end of the day, that's what you want to do. A lot of patients would say, I don't really care how far I walk in 6 minutes, or I don't care how fast it takes me to do this, or the time. That it's more of, I want to be able to get down on the floor and play with my grandkids, or I want to coach my kids' soccer team. And so I have to be able to run along the sidelines and do this and kick a ball. And it's kind of having some of those goals and reframing it so that, one, we have to have some sort of kind of standardized measurement to track progress over time. But those patient goals are absolutely key. And like the ones that come in of, I want to be able to go up the couple of stairs into my house, so I don't have to go back around my house and take the ramp up. And so working with physical therapy, that he's been working on going up and down the steps independently. And so it's a combination in order to show how you're reaching your goals. So I know we have just a few minutes left here for any other kind of comments, questions.
I think that would be a very interesting idea, but instead of a survey, I believe things are coming where you'll be able to measure someone's pain when they put the prosthesis, when they put their socket on and when they stand. And so you can kind of see, or I don't know if you guys have them, but there's a few things that fit, that there's some fitting techniques where you have the patient standing into something that's almost like a large blood pressure cuff. And, you know, it holds them and it holds their weight. So it's like if you could allow them to bear weight and then measure pain. So, you know, an ideal is going to be like, it's kind of like, yes, it's kind of like there's not infinite ways you can stand. There's lots and lots of little changes we can make by how many times we turn this bolt and that bolt and, you know, and what kind of this and what kind of that. But if you could have them bear weight and then gather data on where their weight goes versus pain, that would be, and feed that data into a machine, that would be incredible. So that would be unbelievable, like machine learning level stuff.
Right.
Yeah.
I really appreciate that he's on here.
Yeah.
And I would love to know, like, if your goal is to continue assisting for O&P, or if you know you're on here to continue your education, and if you know you want to go and get your master's, or if you literally just want to be the best assistant you can be, so you're like pursuing all the education you can get. Because I think it's really cool you're facilitating these conversations too.
Oh, thank you. For a minute, I didn't realize you're talking about me. There's a master's program opening by me, but honestly, I'm happy being the bestest assistant I can be, if that's where life takes me. And, you know, and I'm happy. Yes, there's a pay increase, but I feel like, you know, cross that bridge as it comes. And, you know, I don't worry about it, because I already have too many degrees like a professional student. I am a self-admitted professional student, so I don't. So, but
Hey,
and
the
I'm
learning
sorry
never
I missed
stops.
most of this. I just now got off. So
Are you in Oklahoma?
no. No, I don't mind telling you, I'm in between Kentucky and Tennessee. So I go to Nashville sometimes, and sometimes, you know, sometimes my patients are, you know, usually they come in, sometimes they have to drive quite a while. Sometimes they have to drive from, you know, quite a while. Was anyone else here from Oklahoma?
No, I know they have a really great assistant program. So that's
Okay.
Yeah.
Okay.
Patricia and Lynn, do you have any last questions too? I know, Lynn, you were mentioning getting some people help in like Kenya and Africa, and Abbey's got some good things with Operation Namaste going on.
Yeah, Abby, I was going to reach out to you after this to kind of find out if you had any resources. I'm trying to help somebody who's in Kenya now. But the only thing I'd like to say in closing is, of course, thank you very much for having this. You know, improving quality of life after amputation is, you know, that's my passion. And I just want to say communication. That's the biggest thing. Call your prosthetist every day. Just because this way it could be documented in the notes, even if you add a sock, it can be documented in the notes so it could justify your next replacement socket. So that's it. Thank you.
Yeah,
Thank you so much.
Lynn, thank you again for joining us. We're always happy to have you back and love what you add to the conversation. So I'm glad to see you back again this month.
I appreciate it, because I appreciate being accepted. I don't know what else to say. Welcome.
No, you joined and we love, I mean, same thing, right? You have the same goals. We're here for education. We're here to help everybody advocate for the care that they need and the care that you deserve. And that's what this comes down to, is we are here to kind of just create this space to help other amputees kind of help each other out and create the space for conversation. So thank you.
Oh yeah, of course. And the big thing that you brought up today is about standards. You know, anybody can make any socket anyway. And it's like, what? How could that be? You know, we have standards for the knees, the foot, you know, how many times a foot can bounce up and down, but nothing for a custom socket that goes against our skin, and all of our limbs are different. you know, but thank you.
And we'll be doing this. We're gonna try to do it once a month now. So feel free
nice.
to join us.
And submit, we do want to try and have like maybe a topic for each one. So we'll still have the open Q&A, but maybe more of a guided conversation for each month. So kind of talking about, like we talked about swimming and getting in the water, and then with winter coming up, of dealing with different seasons, dealing with maybe some helicopter family members after amputation, and how to manage certain situations. So if you have a topic suggestion, if you have your questions, send us a message beforehand, make a suggestion on Facebook, send us a direct message, send us an email, because we're here for you. We're here to support you and kind of help provide information that's beneficial in any way that we can, and kind of help facilitate conversation. So
Patty, did you have
This-
anything else that you?
No,
would
I
like
was-
Thank you very much.
This has been very helpful. I really appreciate it. Thank you.
yeah, thanks
Yeah,
for
thanks.
joining us.
Bye.
Bye, everybody.
All right.
Have a good
Thanks,
night.
everybody.
Take care.
Yeah.
Thank you.
Lynn, you could stay on and talk to Abby real quick too, if you want.
Okay. Bye.
If you're free.
Bye.
Hear me or no?
I can hear you.
Oh, okay. So anyway, I have this guy in Kenya who reached out to me on one of the amputee support groups, and he's just wondering.
I haven't
there's
left
any-
yet. Let me see where to leave. Sorry.
You're
It's okay. It's okay.
Let's see.
But-
I'll just, there we go.
Well,